Okay, welcome everybody. This is Men of Hope, a Hope Scout and podcast. My name is Bernhard and today I have an old friend of mine with me here, David Lach. We studied at Franciscan University together, our master's program. I studied theology. David, you studied counseling, and we were in the same community, the graduate non-traditionals, like the same friendship circle, basically. And it's a pleasure to have you on here today. We want to talk about counseling. We want, in particular, talk about acceptance and commitment therapy, which you are very passionate about. And yeah, David, maybe you want to introduce yourself a little bit and your passion about counseling. What made you decide to become a counselor?
Yeah, thanks for having me on. Appreciate it. So as Bernhard mentioned, I studied my master's at Franciscan in counseling. I currently work at Catholic Charities of Idaho in Boise as a mental health counselor. But I first got interested in counseling. I guess the first prompting in a way was I was a Dominican friar for 2 years. I was in seminary, and one of my most fulfilling parts of that was just being available to people. You wear a white habit and people feel pretty comfortable approaching you, and I just found that very fulfilling to just walk with people. After I discerned out, I eventually got a job helping people find employment in a social services job. And it was a small part of that work, but one of my favorite things was to mentor people, help them with people skills, interview skills, work skills. And I realized that's the part I really wanted to keep doing, and I got good feedback from my colleagues. And I did have a moment of discernment about, okay, where do I want to go in my life exactly? And I ended up actually found a book at one point that talked about for your career path, follow not necessarily just your immediate passion per se, but look at what you're good at, and passion will follow from there. And it made me really reflect on, okay, what skills have I developed? Even what gifts do I have? And it just became clear, especially through prayer and even a moment of grace, that counseling was the path for me. And so I ended up going back to school, received my master's in counseling, and that's kind of how I just grew to love it more and more as I kept developing my skills and learning more, both in my own personal life, through personal growth, and just through serving others as well.
Beautiful. Thank you. Yeah, it's beautiful to have witnesses who, on the one side, have been in monasteries. Like, that's what we have together. I have been in a monastery for 4 years, and we both became counselors. And how that impacts your personal desire for personal growth and helping others to grow and heal as well. Mm-hmm. That's wonderful. Yeah, we had some good time here at Franciscan together.
Oh yeah, absolutely.
Community. Yes. So, and we had many conversations in the field of counseling, and then you went to Columbus and worked there for a year or two, and then you moved to Idaho. And we had a lot of conversations about acceptance and commitment therapy, and I found that approach very interesting as well, because I think it's very adaptable to, I don't know, our Catholic mindset, right? Like theology. Do you want to share a little bit more about that and because you practice acceptance commitment therapy, like mainly, right? Or at least it's one of your main approaches.
It is one of my main approaches. I wouldn't say like exclusively, but it's definitely the main paradigm with which I view mental health. I integrate other things too, like you could say classic CBT, internal family systems as well, but ACT is sort of the main paradigm through which I see mental health. And yeah, I actually got introduced to it because my own counselor at one point was doing ACT. And then eventually my internship, the other counselors there were really interested in it. And I just found that nothing against classic CBT, I still use aspects of it, but I found when I kind of exclusively used that paradigm, I was running into a lot of roadblocks with clients. And I found ACT, kind of one principle of ACT is a kind of flexibility. There's the idea that there's this psychological flexibility you have in a way, regardless of what your mind is telling you, how you're feeling, that there's a way in which you can still move forward. And I found that it provided people a way to move forward in that regard. And yeah, and kind of the way I like to present ACT, the way I think about it, especially from a Catholic paradigm, is that there's this idea that we run into problems because there's a kind of a lack of integration within our internal life. In other words, we have this unhealthy relationship with our thoughts and emotions. And yeah, I think there's a place for looking at the veracity or the truthfulness of a thought, but oftentimes the issue I've found is it's the unhealthy relationship they have with their thoughts. At least is a big part of the issue as well. And so I found that because this idea that since the fall, right, we've kind of had this lack of integration, right? St. Thomas Aquinas, in a basic sense, talks about how, properly speaking, we have our intellect and will, which is sort of like the one in charge of our internal life, and our emotions are subservient to that. And we find that a lot of times in our broken state, especially when we encounter difficult mental health challenges, is that's flipped, right? Our emotions are, as to use like an act metaphor, are driving the bus.
Yeah.
They're sort of the ones in charge. And we even have this sense that my mind is saying certain things, my emotions are reacting a certain way, therefore I must follow them. So our emotions, our thoughts become our masters instead of our servants, even allies for us, right? But there's sort of like a disorder, like a flip. There's like a flip that happens. That's not very
disintegration.
Healthy. Yeah. And what I really like about ACT, in terms of the solution it provides, it's a very optimistic view that it really honors the capacity for human freedom. That we always have a sense of freedom of moving forward, even if life is difficult. And it's not that there isn't a place for kind of feeling better. I'm not saying I think there is certainly a baseline which is reasonable to want to feel a certain way, but I think there can be kind of within the ACT paradigm, there's a sense that if we get a little bit too overly attached to just feeling good all the time, that's actually run into deeper problems. And so paradoxically with ACT, hence the first part of the acronym, acceptance, when we learn to actually accept the place that our emotions have, even the unpleasant ones, then we can actually live a healthier, more fulfilling life. And as a secondary result of that, we can actually feel a lot better. But the primary goal of ACT is not necessarily to just feel better for its own sake, but to actually live a virtuous and meaningful life.
Yeah, that is very awesome.
Yeah.
I love that approach a lot. And I think Jesus's teachings are very similar in regards to take up your cross and follow me, because and I love to teach to my clients or to my students, actually, take up your cross and follow me are Jesus's words for acceptance and commitment, right? ACT stands for acceptance and commitment therapy.
Right.
And take up your cross is kind of like accept your cross, regardless what you feel, what you think, the urges, the reactions of your soul, your body. Just accept those interior cross, and then follow me. Commit to your values, and Jesus is the highest values, right? The highest value itself.
Absolutely.
And so yeah, that's why I like that approach very much. Yeah,
no, absolutely. Yeah. And it's not even just sort of a put up with your cross kind of mentality, right? And I think sometimes if presented poorly, you could risk presenting the acceptance parts, like just deal with it, get used to it, right?
Yeah, offer it up.
right. Which, there's a place for just kind of being okay with the bad feeling, right? But one way I like to approach ACT is also find meaning even in the pain itself.
Yes.
Because interestingly, our emotional pain can actually reveal to us our values and what's important to us. So in other words, let's say you're anxious about let's say you're a student and you're anxious about doing well in your studies, right? Well, you're only anxious in a way, or it's possible you're only anxious because you care about being a good student, right? Or for example, let's say you're sad, maybe an extreme example, someone you cared about passed away and you're feeling sad, right? In that sadness, it actually shows you meaning of how much you cared about that person, right? And so part of the acceptance part is actually integrating and even understanding and empathizing with that feeling you have, seeing the good of what it is, and then moving forward. Yes, maybe it's still painful, but seeing deep meaning even in having the pain itself. Because what people can do, right, is part of the avoidance aspect, is we can often do things to avoid that pain, leading to an unmeaningful life. One example, of course, people consume alcohol to not feel pain, not to feel emotional pain, but then that leads them to not engaging with others, contributing in their work, whatever it might be, right? And they have a choice. Well, I could either numb this pain and have a short-term solution, right? Obviously, that creates a lot of long-term consequence, the long-term pain. Or I can learn to accept, get to know, and integrate maybe even this internally painful experience. But part of doing that path is to live a more meaningful life, right? And then we often do work through that in a healthy way. Maybe, we don't just feel amazing all the time, but that can actually help us work through that emotional pain in a more effective way. Through acceptance.
Yeah, that's wonderful.
Yeah.
I love what you said in the beginning, that oftentimes the thoughts or emotions are not the problem. I mean, oftentimes we treat them as problem, but what we actually are looking here with acceptance and commitment therapy is not so much the thoughts and emotions themselves, or treat them as symptoms, right, that we have to get rid of, but I actually want to look at the relationship to these thoughts and emotions, because our relationship can maybe contribute to even more suffering. And then we avoid the thought or emotions, we try to fight it, but the more we try it, the stronger it gets, right?
That's exactly right. Yeah, there's I think it's especially looking at thoughts, for example, right? I think it's especially notable if we look at something like OCD, right? With OCD, there's these obsessive thoughts, and what often happens is people have these obsessive thoughts, they don't like them, and so they do some kind of compulsion to get rid of it, right? And so what's happening with OCD is there's this fear of the thought itself, thinking that there's some truth to the thought, right? Or that the thought means something more than just being a thought, right? And so within an ACT framework, especially with OCD, the solution is not to keep fighting with the thought, because that's actually part of the issue itself, right? Part of the idea with OCD with regard to thoughts is seeing the thoughts simply as thoughts, even if they're uncomfortable, that it's okay that thought exists, right? There's not like a literal meaning behind the thought itself.
Yeah, and that's so counterintuitive to the way we live, right? Because in our external life, I don't know, I'm hungry, I go to the store, buy something. I'm cold, I put on my jacket. I'm hot, I turn on the AC, or whatever, problem solving, right? Like it works a lot in our world. But what you just said is oftentimes that actually does not work with our interior life. The more I like to do that problem solving, oh my gosh, that thought is so uncomfortable, I want to get rid of it, and I fight it, and I do not get rid of it. It actually gets stronger.
Exactly.
And it's very paradox, like it's a paradox intervention. By the more I embrace and accept that uncomfortable cross, if you will, I take upon my cross, the more I accept it, the less it starts bothering me.
Exactly. I mean, it's like with the whole ironic process of our brain. It's like if I asked you to not think about zebras, and that was really important that you not think about zebras, what are you going to do?
Yeah.
You're going to think about zebras even more, right? So imagine a thought that you don't want to have, right? And you're like, oh no, I can't be thinking this. And that's the paradox, is the more that you embrace it and be okay with it being there, even if uncomfortable, it becomes a lot lighter. And so I'll give you an example in terms of even like a treatment goal within a ACT framework is for OCD, the goal isn't necessarily that the person stop having the obsessive thought. The goal would be that the person can live the life they choose to live without interference from thoughts. So maybe the thoughts go away, maybe they don't, but in the end of the day, it's like we hopefully get to a point where it doesn't matter whether the thought's there or not, because it doesn't have authority over their life, right? But to your point too, right, the reason that we operate in this way, because we are problem solving creatures, and our brains are problem solving machines, right? It's always looking for ways to solve issues, right? But oftentimes that can get us into trouble if we're constantly just going into that problem solving kind of survivalist mentality, right?
Yeah, that's awesome. I love that approach very much too. Basically, to summarize that approach, very simple into 1-2 sentences, basically, you accept the interior life in a detached, non-judgmental, non-reactive way, and then you commit to your values, like in order to live that life that you choose to live, regardless if those symptoms or nasty feelings or thoughts are still here or not.
I would say, and I would just add a one little caveat, I suppose, is it depends on the situation, but sometimes being merely detached doesn't quite do it for people, right?
Mm-hmm.
Because sometimes, especially I maybe not so much, it's possible with an OCD issue, but even in there, but especially with an emotional issue, kind of going back to the idea that our emotions are still showing up for some reason, even if it's not for as an important reason as they're trying to say they are. Like, because when we're in emotional distress, whatever that emotion is, whether it's anxiety or sadness, says, "Hey, this is the most important thing," and it's almost like at extreme points it can feel like life or death, right?
Mm.
Now, yes, maybe the emotion is so-called overreacting, setting off alarm bells, even false alarms, but the alarm is still going off for some reason, right? And so it goes beyond merely tolerating, but actually getting to know, even in a deeper way. That's why I like using kind of an IFS integration, internal family systems, or what we maybe call parts work, where we even get to know and understand and have compassion for, okay, what is this emotion trying to tell me, and how do I bring it along and actually integrate it in a healthy way? So there is a bit of a detachment in terms of not being enmeshed, and it like almost think of like a family dynamic, not unhealthily enmeshed with an emotional or internal experience, but being sort of distinct from it, recognizing that you are two distinct things, but then integrating it in a way that's actually healthy.
Gotcha.
Yeah, yeah.
So the caveat is kind of, yes, I do the detachment at the same time. Yeah, that's also kind of like a paradox a little bit. On the one side, I want to be detached. On the other side, I want to integrate it in a healthy way, right?
Right.
Yeah.
Yeah, the act has some funny sort of verbiage or jargon. One of them is something called diffusion.
Mm-hmm.
And that's opposed to something called fusion, where we're fused to a thought or emotion, where we have again that healthy and unhealthy enmeshment with it, where there's almost this distinction or this lack of distinction between myself and the emotion, myself and the thought. We even hear this in kind of the way we speak in English. We say, "I am anxious."
And
Right?
over-identification.
Exactly. As opposed to, and there's actually kind of a semantic technique within ACT, where instead of saying "I am anxious," you say something like, I'm having the feeling of anxiety." And that's a technique called diffusion, where you're not fused to the thought or the emotion anymore. But then once you can distinguish yourself from the emotion, you can then you're in a better position to actually understand it and then integrate it better. Right. So that's kind of the paradox.
Yeah.
Distinguish, like any relationship, right? You can have a healthy relationship if you're not enmeshed in it, right?
Yeah.
Kind of learn the distinction where you start and stop, the other person starts and stops.
And how does the integration look like? Is it that acceptance part that I say, okay, this is part of me, but that is not me.
Mm-hmm.
And I can still pursue my values. I can still pursue a good life.
Yeah, it looks different for every person, of course, right? But there are kind of different steps you can take, right? And a good first step is just that aspect of recognizing the distinction between you and the feeling or the thought. Very fact there is a distinction, and even just getting used to the idea of observing, right? And so one core aspect of ACT is mindfulness, where you're kind of aware of the present moment, which includes your own emotional experience, right? So a good place to start, for example, could be just the bodily semantic feeling of the emotion itself, right? So you could even, for example, like for you, anxiety feels like a tightness in your chest. You can just be more aware of that feeling of tightness. Just being, okay, there's that feeling. And then it could be going from there to imagining your emotion of anxiety as a thing in a way, almost using your imagination to kind of represent it in your mind in some way. And then with the acceptance is maybe understanding what it's trying to tell you, right? Acceptance could also be realizing that this feeling I'm having, it's okay to feel it. Like, I will survive if I have this tension in my chest, for example, right? That's where another example where that can be a really big issue for people is panic disorder.
Yeah.
Where there's this illusion of this life or death situation happening, this panic of feeling I'm going to have a heart attack or something like that. And so part of the treatment for panic disorder is to realize like this feeling, not to be too condescending to it, but just to realize this feeling is just a feeling. That's what it is, right? It's nothing more, nothing less. That's what it is. And I can make space for it. So kind of making space for that feeling itself. But then maybe diving a little bit deeper, getting to know it, understanding what it desires, right? and then kind of integrating in that sense. And I think that's why our Catholic faith is so informative, right? Because we believe that even though we're broken, that we are still fundamentally good. And everything in us is fundamentally good, but maybe it's misdirected, right?
Yeah.
So this anxiety response, in a way, it's very good that we have that feeling of fear. It keeps us safe. Or a feeling of sadness helps us to realize a good that we're missing. Or anger helps us to see what's unjust. And so part of that acceptance could also be psychoeducation on what is fear? Why is it a good thing? On a fundamental. Maybe it's not helping you right now, but at a core level, it's something good there. And so also understanding, having a sense of empathy for that mechanism or that part of us, right? So I think that's also a very important part of that acceptance.
Yeah. I think that goes so beautifully along with our Catholic teaching or the theology of the body, right? Where we learn our body and our sexuality is in itself good.
Yes.
But it's so sad that even within the Catholic Church, oftentimes we teach young people to be afraid of their emotions, for example, to avoid the sin of lust, right? And I'm a huge fan of Conrad Bowers on that topic, the way he teaches things, because lust, for example, if we talk about that concrete example for a moment, lust in itself, on an emotional level, like the desire for beauty or the desire of a woman or being attracted to beauty in itself, is a good thing. My emotion of desire, my body, and the beauty of a body of another person is a good thing in itself. So we don't have to repress that because, oh my gosh, I'm already looking lustfully at a woman.
Right.
The problem with lust is not in that emotion of desire or maybe even love, if you will. The problem with lust is in the intent, like a willful decision to use that other person for my own gratification. So the problem is an act of the will, not in the goodness of my body or the goodness of the other body. And that's kind of like, we have all that beautiful teaching within the church, but at the same time, oftentimes children or young people are catechized in a way of being afraid of their own feelings or being afraid of, I don't know, sinning, right? I'm immediately sinning when I'm attracted to a beautiful woman.
Right.
And acceptance and commitment therapy actually helps us here to, from a secular perspective, right? Now how we can ask, how can we use that in a Catholic setting? But from a secular perspective, it actually helps us to see the goodness of our body, to see the goodness of our emotions, to see the goodness of who we are. And it's just very wonderful.
Absolutely. Yeah. And I think that what you said is key, right? It's like, what are we choosing to do with that feeling we have, right? And yeah, maybe our feelings are reacting more strongly in a way that's not according to what we value, but it doesn't mean we have to listen to it and obey it just because it's there. And that sensation itself, right? It's maybe there might be a level of disorder, right?
Yes.
But it doesn't mean that the origin, kind of the disorder, it kind of implies that there's a right order of a thing. It's just the thing that's good has been disordered, right? Been disintegrated, or however you want to think about it.
Yeah.
And so realizing, right, at the end of the day, it's what are you choosing to do? It's the difference, for example, between anger and wrath, right?
Yes.
Sometimes this is a very common thing I run into. People think anger in itself is a bad thing, right?
Exactly.
And that can be a challenge for people to really grasp how anger could actually be a good in itself.
Amen.
Right? But it's what we do with it. And this is, I think, one part potential challenge is a misunderstanding of how Jesus talks about some emotions. And I kind of thought about this at one point. Jesus says in the Gospels, "Do not be anxious." And I thought to myself, how do we understand that kind of within a act paradigm?
Good question.
Yeah. And I thought about it. What he doesn't say, don't feel anxious. He says, don't be anxious, right?
Amen.
And so it's the same thing of whether or not it's like you might feel angry, but you don't have to be angry, right? Especially if it's unmerited. And so I think that's a key part of it. You might have a feeling, but it's kind of what you choose to be with it, what you choose to do with that feeling is the key difference there.
100% agree, 100%. And when you say right order, I think the right order with our emotions is a rational guidance. Emotions in themselves have the innate desire and need to be guided by reason. And the right order is that guidance by reason. And I totally agree with you when Jesus says, don't be angry, anxious, or love your enemies, right? When he says love your enemies, does it mean that, oh, when my abuser or perpetrator is in front of me, I have to have emotions of love and sympathy for that person? Or does he, because I agree with you, I think Jesus is not commanding or tyrannically ruling our emotions here as if we shouldn't have these emotions. Jesus was never dismissive when he encountered people. Like he's definitely talking here, like, don't be anxious in the sense of, he talks to the intellect, he talks to the will. Don't willfully decide, in a sense, to go down the rabbit hole of anxiety, right? Like, trust in me, make an act of trust. Or, of course, I mean, he himself was anxious, he himself was angry. So the emotion itself is not the problem.
Right. And I think what we see from Jesus too is, in terms of acceptance, is what we could think of as a reframing of your internal emotional life, right? The way I like to think of reframing is widening a frame, right? So let's say, for example, you're feeling sad, and what you can do is almost have your frame be really small, where you just see the sadness and that's it. Your whole life is the sadness you're feeling. Now, especially if it's merited, we wouldn't say now just get rid of the sadness and reframe in that sense, just direct your attention elsewhere or suppress it or distract yourself even, but make the frame wider. So there's the sadness that's there, but what are other things going on in your internal life? What are things going, even considering your will, right? And I think a great example of this is when Lazarus died. And what we see there is Jesus, it says the shortest verse of the scriptures, right? Jesus wept. What I find so interesting about that passage is Jesus knew he was going to raise Lazarus. So he certainly had a feeling of hope and confidence, right, in God the Father. But at the same time, there was a nuance where he also felt sad for the objective evil of his friend dying, right? The objective sadness of that happening. And so I think that's another part of the acceptance piece of it that we see from Jesus, is that you can make room for a full breadth of the internal life, right? Of life experience, you know?
Yeah, that's very beautiful.
Yeah. And so that's kind of an act question, is how can we make space for that feeling, right? Yeah.
On the one side, make space because we don't want to repress that whole experience. At the same time, what you said earlier, that doesn't mean I have to express it, because that's the whole thing. The rational restraint of an expression of emotion is completely different of repressing the emotion itself. It can look on the outside completely the same, right? The one person restrains the expression but accepts the interior experience, but the other person also negates and represses the interior experience.
Right.
So,
yeah. And I would actually argue that not accepting your internal experience makes you more likely to do an outward unhealthy expression. And I'll give you a really good example. So let's say somebody struggles with anger, and their thing that they do is they punch walls, right? The reason that they punch the wall is because basically what's happening is they don't like their feeling of anger. And so punching of walls gives them immediate relief. Now, if they actually were more okay with that unpleasant feeling of anger, they wouldn't feel this compulsion to punch a wall, right? And so paradoxically, it's actually deeper acceptance allows you to have deeper control of how you live out your emotions. And now, again, it doesn't mean that you don't do anything with that anger. Maybe there's a place, maybe you're angry because your boss said something unkind to you. And so the anger is saying, hey, that wasn't right. It's a more value-centered way and virtuous way to sort of take that anger's input is to have a constructive conversation with your boss to address that injustice, right? To get a little technical, but that requires you don't get relief right away just by punching a wall. You have to kind of carry that discomfort with you, maybe even have a difficult conversation, but you're still living out that kind of that core need of that anger, but in a productive, virtuous way.
Yeah. That's an amazing distinction. I'm doing a book study right now on Conrad Bauer's Healing Your Emotions. And we were talking about a similar issue on anger, on the emotion of anger. And one of our group participants, he is a counselor. He wrote in the chat, that it is possible to be kind of addicted to the expression of anger because it gives you some dopamine release or some relief in your emotions when you express it. You can be addicted to the expression of the emotion of anger, at the same time repress and negate anger itself.
Right.
Because you don't allow yourself to feel and face it and understand it. You're only kind of, as you just said, like it has that's so paradox, right? It's so counterintuitive, but I think that's phenomenologically correctly understood, that when I repress, I'm not happy with my emotion of anger, then I repress it all the time. But how long can I repress it until it goes poof?
Exactly.
And then I explode. And then I
Right.
get addicted to that expression of anger, while at the same time not being able to accept that emotion.
Right. Yeah. And people can be, sadly, it can be very frustrating to how aware people can be of that. It's like, I know I'm in this vicious cycle, but I don't know how to get out of it. And it's because in that moment, it is very, very addicting, right? Because it does. The reason we do these things that aren't value centers because they feel good in the moment, right? Otherwise, we probably wouldn't do them. And so I could, there's like, even in terms of self-compassion, I think that, and that's an important first step, is understanding, there's something that feels good about that, right? And so, and I think that's an important first step of kind of working through that, right? But it's very understandable why somebody would be drawn to do those things, right?
That is fascinating.
Yeah. And I guess kind of if I may pivot a little bit, come in terms of the second part of ACT is identifying, living out your values. That's why that's such an important part, right? Because for several reasons, right? Because it can help people clarify, okay, if I'm not going to punch walls, then what do I do, right? What does it look like to live out a value-centered way to either express this emotion or resolve whatever conflict came from the emotion, right, itself, right? Which is why that's such a very important part of that process. And that's again why I think our faith adds so much to this, right? Our faith gives us really very good insight, of course, what it looks like to live a virtuous life, right? So we can look to the life of Christ, life of the saints, to how to deal with these difficult situations in a virtuous manner, right?
Very well said. That's great.
Yeah.
I would like to read very briefly a quote from Padre Pio, and I would be interested to hear your opinion on that.
Yeah.
Because it's very similarly very counterintuitive, oftentimes, to our Catholic culture. And let's read it. And how does that align with ACT?
Yeah.
So Padre Pio says here, don't try to defeat your temptation, right? That's already the counterintuitive thing. Like, don't try to defeat your temptation, because that will only make them stronger. Simply despise them and think no more about them. Imagine the crucified Jesus Christ in your arms and lie on his chest, and say again and again, kissing his side, which is so close to you, this is my hope, this is the living source of my happiness. My Jesus, I hold on close to you and will not let you go until you have brought me to a place of safety.
Yeah, that's very interesting. Yeah, like you said, don't try to defeat them. Kind of like I've heard the adage, the idea is don't try to argue with the devil. You're not going to win, right? And it's kind of similar to that. And I could see especially that quote being relevant in a situation where you're not really sure what to do with your emotional experience. And the only thing you feel like doing is some kind of sinful action, right? And I think in that case, I don't want to assume exactly what he meant, what St. Padre Pio meant in that case, but it could be kind of the temptation referring to the desire, specifically not maybe the feeling like we're talking about, but the desire to do something sinful in particular. And basically that urge, whatever that is, not giving that any authority. It's simply there, and you might even still feel it, but realizing that there's a kind of, maybe there's a place just for surrender and a restfulness, right? Of just being secure in your identity in Christ and kind of finding your security in that. And surrendering even the fact that there's this struggle you're going through, and which can feel very unpleasant, right? And I definitely see too, this comes from the lack of acceptance, especially as Catholics. People can say, I feel like I do my best to be a good Christian, so I almost shouldn't be struggling in this way. I shouldn't even be having these feelings, these thoughts. And so it can be this inordinate amount of shame. And unfortunately, when you have this inordinate and disordered sense of shame, it gives those thoughts and those feelings and those urges more authority than they're merited, right?
Mm.
And so it's kind of an act of surrender, saying like, yeah, I humbly, in a way, just acknowledge that this is here. But again, kind of look at that reframing. What's a more important fact is my identity in Christ. And then I can kind of, in this very moment, rest in him.
Mm. Even if I don't fully feel it, right?
Exactly. You might not even feel the presence of Christ, right? But
yeah,
and it's a great blessing if you do. But kind of being grounded in that and rooted in that and kind of widening. And that's, I once heard that, I think I heard this from Dr. Kevin Majors. He said that faith is the ultimate reframing. Kind of widens your sense of scope and realize there's a lot more here than just my own internal experience. That's still there, not denying that. But what's more of a deeper reality is God's presence in this, even in this very moment.
And I call upon him and make that act of surrender, and he is going to help me.
Right. Exactly. And I mentioned kind of the idea of the focus of ACT is how can I live a value-centered, have a value-centered action in this moment. And sometimes the only value-centered action we can do is refraining from sin and resting in God. But that in itself is something that we can do and kind of find a sense of contentment in, which is hard to do, especially if it's a very difficult moment, right? But I think there could be something very freeing about that.
Yeah, thank you so much. So I think we were able to give a short insight into how acceptance and commitment therapy, which is actually a therapy school of thought that comes from behavioral therapy, right? I think it's called the third wave of therapies within the behavioral therapy. And I think, yeah, it's such a wonderful development of so many good things in counseling sciences that align so beautiful with Catholic teachings. Yeah.
It's amazing. Like I went to an ACT workshop, and it was not a religious one at all, but they kept talking about things like redemptive suffering without saying those words. And I'm like, wow, this is this is like amazing. Like you can live a full life and sometimes even find meaning in suffering. I'm like,
I mean, what a blessing that people, even secular people, figured it out, right? Because maybe this could be our last discussion point here. Because when I lived in the monastery for 4 years, what I got into that was very fruitful for my spiritual life and emotional life was meditating on the Passion of Christ. And I realized when I meditated on the Passion of Christ, and I was studying some mystics who said that, meditating on the Passion of Christ gets you spiritually, mystically in a place where you achieve a union with Christ, a mystical union through these wounds that you contemplate. And then through his wounds, you are healed. Kind of like, and the beautiful thing is we can do that by, I don't know, let's say I have a physical ailment of headache, and then I meditate on Jesus's crowning of thorns. So what spiritually mystically happens, I unite my suffering with his suffering. That's the offering up here, right? And then the Lord unites his cross with my cross, and I stop from, egocentrism and self-pity. Oh, I'm so poor, I have so much headache, and look at Jesus and his crowning thorns. And in this way, I kind of detach myself because I'm looking at him and not so much at myself. And still I'm connected with him.
Right.
And then I just stay with him and follow these movements of the Holy Spirit that lead me to a mystical union with him. And then through his wounds, I'm healed. And then I receive healing through the union with Christ. I found that I think acceptance and commitment therapy, as you just said, is a beautiful way that helps us understand redemptive suffering and can help us to pray in a way that unites us with the Lord, that is not just a dismissive saying to people, just offer it up.
Right. Or just get over it. Just get used to it. Yeah. I mean, this is kind of maybe a pretty big topic, but one part of ACT as well is the self-concept we can get sort of wrapped into. And I think what's really beautiful about our faith is you look at the saints and I mean, I think there's a place for like affirmations. I don't want to demean that, but if you do look at the saints, there wasn't a lot of like, we can resolve this through like this struggle I have through just affirming myself enough, right? What they talk about is being hidden in Christ. And so sometimes with ACT, the idea is not to like fight that battle of what do I kind of like evaluating how I'm doing in this concrete area. Like, am I a good student? Am I a bad student? Am I a good employee? Am I a bad employee? It's just sort of like, kind of letting go of that whole process, being grounded in Christ and letting him live through you essentially. So that's kind of like, just kind of, it's a big topic, I know, but it's kind of what you're just saying reminded me of that. Stop, like kind of like taking your focus off of yourself and am I measuring up or whatever it might be.
But how do these ACT people do that without Christ? Because you just explained it with Christ.
Right. It's a good question, and I'm sure there's a lot of nuance somebody could give. I honestly feel like there is a bit of a struggle with that.
Mm-hmm.
I'm getting in the weeds here a little bit, but in ACT, there's this concept called self as context, as opposed to seeing self as content. So self as content is this unhealthy sense where we try to like base our sense of self and how we're measuring up, whether we're doing a good or bad job on things, basically placing our identity in very changeable things. Right? And self as context, the idea is seeing yourself almost as like just as yourself. And I've heard it described as self as process. And it is kind of an abstract topic, a little bit enigmatic maybe. And I've seen some people almost embrace a semi-Buddhist concept of it, of seeing almost like a non-self. And that has its own problematic issues, of course. And kind of along those lines, Buddha talked about how the issue when we get attached to things that aren't permanent. And to his credit, he's right in a way. But the problem is he saw the self as non-permanent, right? Whereas we would see, in a sense, we do have a soul. There is a kind of stable sense of self. And of course, God himself is permanent, right? And so I think that's why Christianity provides an answer of how we can have a true self as context of something that's unchanging and stable, that's not dependent on changing factors. And so I think it's thing that our faith really contributes to, that helps us to tackle that whole problem.
That is very beautiful.
Yeah.
Because Jesus Christ and his union with him is the context, the stable thing, right? Regardless of what I feel, what I think, what happens around me.
Exactly. Yeah.
Great. Yeah, David, thank you so much. That was an amazing conversation. I love the topic of acceptance commitment therapy, which helps us actually to understand the gospel and redemptive suffering and how to take up our cross, right? This is wonderful. Thank you so much for your time. Thank you for being with me. And yeah, I hope I have you on again in the future.
Yeah, thank you, Bernhard. I appreciate it.
God bless you, David.
Bye.